Hello everyone, it's the Flyfoot Doctor. So today we're going to be talking all about gout. So all your questions, all your comments, leave them down below. If you have anything, if I don't cover it here, I'll be sure to cover it in other videos. Welcome everyone, it's the Flyfoot Doctor. So today we're going to be talking all about gout. Alright, well, what is gout? Gout is an inflammatory arthritis that happens due to an excess of uric acid in the blood. Well, you may be wondering, well, what is uric acid? What is that? Well, uric acid is a byproduct of the breakdown of purine. I know, another word or another term that we have no idea what this is. What are purines, for goodness sake? Purines are proteins that are usually found in a lot of things that we eat. And as you know, they say proteins are the building blocks of life. When you have to break proteins down, this purine, when it's broken down, the waste product of that is uric acid. Now, there are two ways in which our body will usually have excess uric acid. The first is if we're just breaking down purines in a fast way that our body is not able to keep up with the metabolism and excretion of it. The second way is we're just not able to excrete it fast enough. So in one hand, we're breaking down the proteins a little too fast, and on the other hand, we're just not excreting that excess uric acid fast enough. Now this uric acid goes and chills out in our joints, especially the big toe joint. So typically when patients come in or when people have this symptom, they will complain of a red, hot, swollen joint. And you may see some pictures, and you may have even had it yourself, or you've had family members who've had it and they just did not know what was causing this. Well, a lot of the times it could be gout. If you see it in your big toe joint, definitely one of the first things you should think about is definitely gout. The uric acid has gone there to kind of accumulate and settle and form these crystals that sometimes you may even feel. And in extreme cases, you may actually even see the white tophi that kind of looks like cottage cheese. You will see that there. And I'm actually going to link a video up here somewhere of this kind of tophaceous gout. It's from my other channel. You'll see when we talk about that, okay? So, like I said, what are the symptoms? A red, hot, swollen joint, pain with movement, you're unable to even move that toe joint at all. A lot of that is the very first symptoms of gout. So now you have gout and you want to diagnose it. How does this get diagnosed? Well, the clinical picture is certainly very important. We need to see that you're having an acute gouty attack or acute flare. Also, the next thing that we can do is we can take an x-ray. In some severe cases, we can see some bony breakdown actually, and that'll help us to kind of think and narrow down our differential diagnosis. Also, we could do a blood test that kind of measures your uric acid levels. Now, keep in mind, for my healthcare providers out there, not everyone who has an acute gouty attack will also have a high serum uric acid level. Sometimes it may be normal and it'll still be gout. A surefire way to diagnose it is by arthrocentesis. And what that is when we draw fluid from the joint and we send it to the lab for pathological analysis. And they look under the microscope and they see certain crystals that will really help to narrow down the diagnosis of gout. Also, when we perform that procedure, it helps us to rule out other possible causes of a red, swollen, hot joint like infection or some sort of septic arthritis. Well, if you've been diagnosed with gout, how is it treated? Sometimes the flare could just go off on its own and just get better. Other times you do need medication. So sometimes over-the-counter medications may actually help with the inflammation. A lot of the times you actually need a prescription strength anti-inflammatory and gout medication to actually help. Alternatively, sometimes when they perform the arthrocentesis and take some of the joint fluid out, they can actually inject some steroid there that'll be a localized anti-inflammatory treatment to the area where you're feeling pain. After this is all said and done, you need to be on a gout maintenance medication that will keep the flares down. You don't want to run around here having attacks every month, every week or every other day. If you're having it that frequently, you're definitely not managed, and there are just some things that you're doing that's exacerbating the frequency of these gouty attacks. Well, what are the risk factors? Are there some people that are more prone to having gout than others? I mean, who are the people who are going to get gout? Well, there's certainly risk factors that could increase the chance of you having gout. Number one is diet. If you're eating a high protein diet or a diet that is high in fructose, that will certainly increase your chances of having gout. Also, it has been found that men actually have gout usually earlier in life than women, and this is because women have the protective effect of estrogen. So a lot of the times once they go into menopause, then you start to see that they start to possibly have gout, but men will develop it earlier and more frequently than women in general. Other risk factors include having other comorbidities like high cholesterol, diabetes, high blood pressure as well. In addition, obesity is a very, very high risk factor. You got to think, how did they get to that point in the first place? Probably eating a lot of unhealthy foods. And so that definitely increases the risk and the likelihood of them getting gout. Another way that gout could also come about is hereditary. So if you have a family member, if you have a dad, a mom, an uncle, a close relative that has gout, chances are there is a possibility that you may also get gout. Alright guys, this is a quick breakdown of gout, how you get it, the risk factors, how you treat it, how you diagnose it, etc. Keep with me, and in the next video, which I'm going to be posting, we're going to be talking about diets for gout. You don't want to miss that, so hit the subscribe button. Also hit the notification bell so that as soon as I post it, you'll be notified that I posted it. If you have any questions or any comments, leave them down below. I'd really appreciate it. Till next time, it's the Fly for Doctor.